Antimicrobials such as antibiotics, antifungals, antiparasitics, and antivirals have become a vital part of the modern medicine. Every day across the world, we rely on these medicines to treat serious infections such as malaria and TB. Antimicrobial medicines have been used for saving many lives. Antimicrobials is the term we use for all medicines that kill or inhibit growth of microorganisms. Antibiotics fight bacteria, antivirals fight viruses, antifungals fight fungal infections, but they all come under the umbrella term of antimicrobials. And microbes developing resistance to these agents is a problem in every country worldwide. The overuse and misuse of antimicrobials has led to the development of antimicrobial resistance, AMR. AMR means that the medicine we usually use to treat infections become less effective over time. The tripartite, which includes the World Health Organization, the Food and Agriculture Organization, and the World Organization of Animal Health, reported that the cost of AMR is significant to us all, as well as increasing death and disability. AMR can have financial impact on the economy. Additionally, no new classes of antibiotics have been invented for more than 30 years. The development of AMR has led to some infections being difficult to treat or untreatable with the medicines we have available, leading to the prolonged treatment, high cost of infections, and even death. Germs such as bacteria, parasites, fungi, and viruses can become resistant to antimicrobials. These resistant microorganisms can be spread between people or patients if there's a lack of clean water or poor infection control and hand hygiene practices in healthcare settings and in the home. To prevent the spread of resistant germs between people, it is essential that we all follow the World Health Organization recommendations for infection prevention and control, including hand hygiene. You can also ask for advice from your local health facilities. To reduce the development of AMR, it is important that we only use antimicrobials when they are needed. Antibiotics are essential to treat bacterial infections, but they do not work on viruses. So, antibiotics cannot treat infections such as colds, flu, and COVID-19. Taking antibiotics when they may not be needed encourages harmful bacteria that live inside us to become resistant. That means that antibiotics may not work when we really need them. Inappropriate or overuse of antimicrobials in animals and disposal of antimicrobials into the environment also contributes to AMR. Patients and the public like AMR must understand that taking an antimicrobial when it is not needed contributes to the global burden of AMR. AMR has been self-medicating with antimicrobials for medical conditions not requiring their use since her childhood, which is one of the major causes of AMR. Antibiotics are essential to treat serious bacterial infections such as meningitis, pneumonia, and sepsis, but they are frequently being used to treat illnesses such as coughs, earache, and sore throats that can get better by themselves. Or sometimes people take antibiotics for malaria, which are caused by parasites, not bacteria. Taking antibiotics encourages harmful bacteria to become resistant. That means that antibiotics may not work when you really need them.
I can help prevent the spread of AMR by only using antibiotics when prescribed by a healthcare professional, by not demanding antibiotics if the healthcare professional says I don't need them, only obtaining prescribed antimicrobials from reputable sources, preventing infections and stop them spreading by checking myself and my family have had all of our immunizations, washing my hands regularly with soap and water, catching coughs or sneezes in a tissue and binning it, preparing food hygienically, avoiding close contact with sick people, practicing safer sex. All healthcare professionals should understand that their own individual prescribing or administration behavior has an impact on AMR. How can healthcare professionals help to prevent AMR from developing?
As a healthcare worker, I can help prevent AMR by preventing infections, ensuring hands, instruments, and environments are clean, by following local infection treatment guidelines when prescribing antimicrobials and not prescribing antimicrobials if patients have no evidence of an infection, by reporting antimicrobial drug-resistant infections to public health government surveillance teams where available, by counseling my patients about how to take antibiotics properly and the dangers of misuse and AMR, by talking to patients about how to prevent infections, for example, vaccinations, hand washing, and safer sex, by using parental antimicrobials only when necessary and consider switching promptly based on patient status. We all must take responsibility for changing our individual behavior and act now, or these precious medicines will no longer be effective for patients who need them in the future.
To find out more about what you can do to help protect these important medicines and help tackle antimicrobial resistance, visit www.antibioticguardian.com/Africa.